Welcome to the Libman Education Coding Clinic Commentary Update for ICD-10 CM and PCS, first quarter 2023. My name is Faye, and I will be hosting this session of our update. Our first two questions in this issue of Coding Clinic address the ICD-10 CM guideline, Section 2B, which provides guidance when there are two or more interrelated conditions, each potentially meeting the definition for principal diagnosis. The guideline states when there are two or more interrelated conditions, such as diseases in the same ICD-10 CM chapter or manifestations characteristically associated with a certain disease, potentially meeting the definition of principal diagnosis, either condition may be sequenced first, unless the circumstances of the admission, the therapy provided, the tabular list, or the alphabetic index indicate otherwise. In the first question, the patient is admitted with acute blood loss anemia due to gastrointestinal bleeding. The patient was transfused 2 units of packed red blood cells and an upper endoscopy was performed. The provider documented the final diagnosis as acute blood loss anemia due to gastrointestinal bleeding. Coding Clinic is asked, what is the correct sequencing of the principal diagnosis? Coding Clinic explains that when both anemia and GI bleeding are present on admission and meet the definition of principal diagnosis, either condition may be sequenced first. This concludes the Libman Education Coding Clinic commentary for first quarter 2023. Thank you for joining us for this presentation.